mynews.studio.
In a country that's made up of tiny islands, how did the Maldives end up being the first in South Asia to stop HIV and syphilis from passing from mother to child?
Today is October 23, 2025. This is a milestone that's both unexpected and really instructive. The World Health Organization has now officially recognized the Maldives for eliminating mother-to-child transmission of HIV and syphilis. How did they manage that?
They launched a national effort. Prenatal screening for HIV and syphilis became universal. Almost every pregnant woman was tested. Treatment was provided at no cost. Public education campaigns reached even the most remote islands. But here's a question. Is that really enough in a country spread out over so many islands?
That's a fair point. The government actually invested more than 10% of its GDP in health. That's significant. It meant free antenatal care for everyone, even migrants. Over 95% of pregnant women received care and were tested for HIV, syphilis, and hepatitis B. And more than 95% of newborns got hepatitis B vaccinations right after birth. Do you see this kind of coverage elsewhere in the region?
Not really. Those numbers stand out not just in South Asia, but globally. The Maldives used mobile health teams and community outreach to reach people on distant islands. They built up health infrastructure and trained local workers. But what about coordination? That's where a lot of countries get stuck, trying to align government, private clinics, and international groups.
The Maldives approached it from multiple directions. The government, private healthcare, civil society, and the WHO all worked together. The WHO provided ongoing technical assistance, and there was real-time data sharing. They also used integrated digital health platforms to track cases.
Wait, so when you say integrated digital health platforms, do you mean something like a national database that all providers can access?
Exactly, yes. A system where data from different clinics and hospitals feeds into a central platform. That way, cases can be tracked, and it's easier to make sure no one falls through the cracks.
And it's not only about reaching the goal once. They've set up ongoing surveillance, routine screening, national surveys, and real-time reporting. If there's even a hint of resurgence, there's a rapid response plan in place. Why does this level of detail matter for other countries?
It's important because it means the approach can be adapted elsewhere. If a country like the Maldives, with its scattered islands and limited resources, can do it, why not other places? It really comes down to political commitment, steady investment, and working together across sectors. Plus, it highlights how combining maternal and child health with infectious disease prevention leads to better results.
And there's a broader message in this. Investing in maternal and child health pays off in the long run for everyone. The Maldives experience is now a kind of roadmap for other countries dealing with high rates of HIV or syphilis. Do you think we'll see this model spread?
That's the hope. Now that the WHO has recognized this achievement, it shines a light on what's possible. It puts a bit of pressure on other countries to set their own targets and to adapt what worked in the Maldives to their own situations.
So the key lesson here, integrated, universal coverage can work even in small, scattered countries. With the right coordination, international support, and investment, these public health goals aren't out of reach.
Which brings us back to the beginning. In a place where geography could have been an obstacle, determination and planning made the difference. Thanks for joining us while we broke down how the Maldives made this happen.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it now for free.